Hi, I'm Catherine Chadrick, and I'm a clinical liaison here at Interim Home Health, and we're here to talk about a really big subject today, and that's falls with seniors. Did you know that falls are the leading cause of both fatal and non-fatal injuries in people over the age of 65? Today we're going to talk about some ways that you can help your loved ones and seniors in the home, or even if they live in senior housing, how you can help them and prevent them from having falls. One of the first ways and best ways that you can help your loved one prevent falls is to assess the area, and I know that sounds clinical, but it's really not. You're in mom and dad's house every day, or your loved one's house every day, or you see them every week. But assess the area that they live in and come up with ways to prevent them from falling by looking at everything. Where does their furniture sit? Do they have rugs? Are the rugs taped down? So you're going to go through and look at their apartment or look at their living space and say, what can I do to prevent falls? The furniture, if they have a favorite chair, it should be a chair that has arms that they can push themselves up in. The seats should be firm enough that helps them stand up easier. The plug-ins, if you put their chairs close to the plug-ins, they're less likely to have falls from trying to plug things in and unplug things. Also, no swivel chairs and chairs with wheels. I know some of these things are their favorite items and some of their heirloom pieces, but if you could go in and look at their home and pick some of these things out and remove them so that they're not so tempting to use them. I know you're going to have to do some negotiating to pull that off, but this could actually really help prevent some serious injuries from falls. The rugs, if they're going to keep them, of course, the best thing would be not to have them at all, but if they really have to have them, then make sure they have two-sided tape on them so they're not going to slide when they're walking across them. The next thing we're going to talk about is the shower, which is a pretty easy one. We all know there's a lot of falls in the shower and in the bathroom itself. So make sure that they have handrails by the commode, and make sure they have handrails and possibly a chair for sitting in while they're in the shower. It sounds easy enough, but they don't always think of these things on their own. So you as a loved one, you got to kind of assess the situation and figure out what's going to help prevent mom or dad or that loved one from these falls. The kitchen, this sounds simple, but they don't think about it. But their pots and pans are often placed someplace down low. And if you find a place to hang hooks and hang their pots and pans up on the wall and pegboards, then they won't be stooping and bending over to pick up things and possibly fall. Also, in front of the sink, in the stove, and even possibly the refrigerator, if you put those non-slip floor mats in front of those items, that can help prevent falls in the kitchen area. Lights in their living space are their biggest ally for balance and gait. So to help prevent falls, make sure that everything is well lit, especially for the nighttime hours. Little night lights in areas that they frequent, like the kitchen or the bathroom. Also make sure that they have batteries in the household flashlights, so that if for some reason that the lights do go out, they have a flashlight nearby, the bedside or something like that, that they can grab to get around. Phones are another big thing. I'm sure you've seen them a million times, but the big desk phones with the big numbers, this really helps them to see who they're calling, and there's a lot of risk for falls when someone's trying to talk to a loved one. So if they're searching around for the phone and can't find it or can't use it, they get frustrated easily and they could lose their balance. Same thing with the TV remotes. The big remotes with big numbers so they can see everything easily. And if they're still able to function well enough to use a cell phone, keeping a well-charged cell phone on them is also a really good idea. The bedroom. So I know it's hard to get them to use assistive devices sometimes. If it's not, then that's great. Make sure that they have a cane or a walker near their bed. If they are resistive to using them, maybe you could talk them into, okay, I know you're not going to be using this during the day, but let's keep something by your bed. Maybe it's a bed rail or a bar or just something solid, not a chair, because that's unfortunately what they go for, is using movable objects in the room to get back and forth to the bathroom in the middle of the night. And in the morning when they wake up, they're very disoriented and their bones are achy, and that's the hardest time and a big opportunity for falls to happen is when they're trying to get up out of that bed and to get to the restroom or to get up for the day. So if you make sure they have some solid pieces of either preferably actual assistive devices would absolutely be the best. And if that's a no-go, then make sure you have very solid, non-moving furniture that is going to be in the line to help them get to it, but not in the pathway itself. Last but not least, pets. I often see families wishing that they could take away the family pet or take away mom and dad's pet because you're really concerned about their falls from the cat or the dog or the pet. We all know that that's one of their lifelines, and we're not going to get rid of those pets until we absolutely have to. So the best thing we can do is attach a bell on the pet so that we can at least hear the pet coming, they can hear the pet coming, and maybe they won't trip or fall as often over the family pet. So that's a good way to secure the household. Goal number 2, a clear head. So does your loved one ever get dizzy or disoriented? Do you ever get dizzy or disoriented? Confused, blurry vision, mood swings, forgetful, easily distracted, don't sleep well? All of these are reasons to cause someone to have more opportunity to have falls. Are they not sleeping well? These are all things that, first of all, you'd probably want to start by checking their blood pressure. It's as simple as a high and low blood pressure can create an environment that is going to increase falls. Also, lack of sleep. If you're not getting enough sleep, we all know the next day you're kind of groggy, you're not yourself, you might be a little bit cranky. Well, that's the same thing for your loved ones. So when these things are happening, number one, you can't just take for granted that it's natural with age. You have to address it even though it may be somewhat natural to start happening with age. Talk to your doctor would be my number one advice for that, is don't take for granted that it's just something you have to live with. Talk to your doctor about what medications you're on, which medications make a difference, what not to mix those medications with. Is there something on there that is a side effect of one of the drugs that you can do without, or that they can replace with something else that is less likely to increase your chance of falls? So be open and honest with your loved ones. Ask them about their medications. Encourage them to talk to the doctor. Go with them when they go to the doctor and say, hey, mom or dad is having these issues. Is there something going on with those? Because our seniors, they don't want to sound like they're complaining, so they just stay on the same course, and of course that increases the chance and risk of falls. You should keep for them a complete medicines list of their prescription and non-prescription medications. And then the doctor can look at those and see if they interact well or not. So always tell the doctor about the non-prescription medications. But keep a list of the medications. When medications change, make sure that list is updated, and they should always have in their possession a list of their medications that they're on. And if they've changed, that list needs to change with it. Then the other thing you can do to help mom or dad or your loved one in their home or wherever they are is pick one day a week and make sure that their pill bottles are filled correctly. One of the big causes of hazards and falls is that residents or seniors don't often take their medications at the right time of the day or in the right order, or they end up with too much of one medicine, not enough of another, and that is a huge cause for injury and falls. Goal number 3. Goal number 3 is to have sharp eyes, and we all know how to do that. Let's make sure that our loved one makes an eye appointment, makes it to the eye appointment, and then the bigger challenge is make sure they actually wear the new glasses. Now, one way you can do that is to make sure that they donate the old pair to the Lions Club or some other organization. But let's take that temptation away to use the old glasses. And then let's make sure that the glasses are clean. That would be the other thing, is we need to get in the habit of cleaning the glasses every day. They get smudges and food and all kinds of things on those glasses. So make sure that they make it to the eye appointment. Make sure that they wear the glasses, get rid of the old glasses, and keep the glasses clean. So that would help immensely. Sight and vision obviously is a big contributing factor to potential for falls. Last but not least is keen ears. Number 4 goal is to have keen ears. What I can say about that is pretty much a repeat of sharp eyes. So if they need hearing aids, make sure they make it to the appointment to get their ears checked. Make sure that they have their hearing aids. They lose them often, so if you find a special place to keep them, anytime you're in the house or you're visiting, always check that their glasses are there, they're clean, that their hearing aids are there, that they're clean, and that they're keeping them someplace easy to find, easy to locate, and that they're able to operate them and use them, that the batteries are working, and simple common sense things like that would go a long way to help your loved ones from having falls. So a very quick recap: 4 goals to help loved ones have less falls and less injuries is a hazard-free home, assess the home and get things out of the way, a clear head, sharp eyes, and keen ears. It's some very simple things and processes you can put in place all by yourself and go through your loved one's home or your home and make sure that all those things are checked off. And I think that'll help a lot in preventing some of these falls. So you have a wonderful day, and I hope that was helpful.